A button is located in the bottom middle of your screen, and you will be asked to use this feature throughout the meeting. Some of you may also be aware that there is a YouTube stream of this meeting available. This option is intended for the public only, and we ask that all registrants please remain in this Zoom meeting. It allows us to capture quorum for the meeting. Thanks, and we'll begin shortly.
Can you change that, Eric? I went to the settings, but sadly they're grayed out because I don't have administrator privileges. Normally I would be able to.
Julian says go for it.
Okay, thanks everyone. I'll be right back.
Perfect welcome to technology challenges. The meeting will please come to order. Good evening and welcome to the 130th Annual General Meeting of the College of Pharmacists of BC. My name is Clara Shoy and I'm the Chair of the College of Pharmacists of BC. On behalf of the college, I would like to acknowledge and thank the Silks Okanagan people on whose unceded traditional territories I'm chairing this meeting from. As we are meeting virtually with board members, registrants, and the public in different locations across BC, I would like to also acknowledge that the Indigenous peoples are the traditional stewards of the lands and waters from where each of us is attending the meeting this evening. I ask for each of you to learn about the First Peoples on whose unceded traditional territory you live and work. Acknowledging territory allows us to recognize the important relationships between land and people, take a moment to reflect and appreciate the individual meaning behind the land acknowledgement and its importance to you individually. I'm also honored to welcome Elder Selkson from the Musqueam First Nation to our AGM to start this meeting in a good way. Selkson is a knowledge keeper and elder with strong Indigenous world views, ancestral knowledge, and traditional teachings, who is widely respected and acknowledged for the level of service, work, and energy he continues to commit to his community. Selkson has been sharing his wisdom with our board over the past year as we continue our journey in learning about the experience of Indigenous peoples in BC and how we can help shape a better healthcare system. I'm grateful to listen and learn from you tonight, Selkson.
That was wonderful. Thank you. I want to say welcome to you, the luminaries of the pharmaceutical world of British Columbia. I want to say that your leadership over the past year has been essential to all of us. I want to say briefly thank you to you on behalf of the 150,000 Indigenous people registered in British Columbia and all of their peers. Your work is of the utmost importance to all of us. You help us to be well and healthy. I remember clearly my past and being introduced to many of my aunts and uncles who knew the vegetables in our areas that helped us to heal. Pharmacists, to say the least, their extensive knowledge, absolutely amazing to me. What could help cure us? What could help us get better? So I'm grateful to you new doctors here for your help. Quorum, see you where and what hooks in squalling, Mamina, us swallowing, Mamina, to slacking in oh my dear friends, in the chant, I'm asking the infinite to please open our hearts and our minds to what it is that we're going to hear. I'm also asking the infinite to please lift us up and give us the strength that we need to move through this sacred work. I'm also asking that the medicines that be help all of us to be strong human beings, kind human beings, and generous human beings. When I was growing up, I was put into the care of my aunts and uncles at a young age because my parents passed away. Their plan was to see what I had the aptitude for. I said earlier, medicine was of an interest to me. But as I sat with my aunties and uncles who knew the many medicines within their territories, when teaching me and showing me, I didn't have the eye to recognize the medicine. One leaf looked pretty much the same to me as the next. So they told me I couldn't be a pharmacist because I had no recognition of the of the plants. So here I am. I get to be a speaker, which in our society isn't one of the most prestigious things to be. Of course, our relatives who know plants, they're at the top of the heap because they help heal us all. In our language, jaja, in the chant, I used the word jaja in our language. Jaja means sacred. Slagen is medicine. It's important for you all to know that in our belief system, our value system, we believe that each one of us human beings is medicine for others. So as I look at the screen and I see all of you really wonderful people, I'm seeing medicine. Medicine that is going to help me to get stronger and maintain a healthy life. As I look at you, I want you to know that we are also Nutsamot. Nutsamot simply means we are one. Nutsamot, cha, slachen, techwalmach, bestimach. We are all sacred medicine to all other esteemed human beings. Once again, I want to thank you for the honor and the privilege of being with you for these few moments to witness your yayas, your sacred work. With that, thank you very much. Everybody wave that I can see. Everybody smile. Smile's the best medicine. Laughter's the best medicine. And you guys should put that into pill form so we can all be happy. Take care, my friends. Once again, thank you for the honor.
Thank you, Silkson. Thank you for sharing those words. They always remind us of how we relate to one another, and it brings such insight. So thank you for that. On behalf of the board, I'd also like to thank you for your continued hope for healthcare and all the effort you put into helping create a healthcare system that can provide thoughtful care for Indigenous people. Our college is committed to improving BC pharmacy professionals' work with Indigenous people, and we do recognize there's still much to do on that front. So thank you for being here with us tonight. Now I'm going to go ahead and introduce the college's board members in attendance tonight. I'll start with myself, Claire Ishoy, District 7, Community Hospitals. Next, I'll move to Stephen Hopp, who's District 4, Kootenay, Okanagan, and Board Vice Chair. Alex Dar Santos, District 1 from Metropolitan Vancouver. Christine Antler, District 2, Fraser Valley. Andrea Silver, District 3, Vancouver Island Coastal. Michael Ortinsky, District 5, Northern BC. Anka Kvach, District 6, Urban Hospitals. Val Dillon, District 8, Pharmacy Technicians. Tracy Hagel, our government appointee. Justin Singh Thind, our government appointee. Katie Skelton, government appointee. And Ann Peterson, government appointee. We also have two newly elected board members that we're thrilled to join us tonight. They will begin their terms at the November 2021 board meetings next week. So I have Terry Gibson, who's from District 2, Fraser Valley. And I also have Eric Sletmoen, who's District 8 Pharmacy Technician. This sadly means that next week we must also bid farewell to two very special board members, our former chair and Fraser Valley representative, Christine Antler, and our pharmacy technician representative, Val Dillon. On behalf of the College of Pharmacists of BC and myself personally as well, I wanted to thank you for your service and dedication and wish you all the best in your future endeavors. And please know your voices will be missed on the board. I'm also pleased to introduce the college's registrar and CEO, Bob Nakagawa. And I know we also have many college staff joining online this evening. Moving on to notice and quorum, we have 29 registrants present. Our quorum requirement has been met. In addition, the college met the 3-week notice requirement. Therefore, the meeting is duly convened. We need a quorum to be present for the duration of the meeting, so please stay until the meeting is adjourned.
Madam Chair, I would note that I see that we now have 54 registrants present. So we have an abundance of people in attendance.
Wonderful. Thank you, Registrar Nakagawa, for the update. I'm glad to have everyone joining us tonight. I know it's been a difficult week, so we appreciate your attendance. Next, we'll be moving on to the agenda for this evening's meeting. It's available on our website and was shared as a part of the AGM registration process. As required as part of our AGM, we will next address the minutes of the previous AGM meeting and the financial statements and auditor's report. Following this, both myself and Registrar Bob Nakagawa will present reports on the activities of the college for the past fiscal year. So moving on to item 2, which is approval of the minutes. The next item of business is approving, as I mentioned, last year's annual general meeting minutes. The minutes were included as a part of the materials provided when registering for this AGM and are available on our website. I would like to ask those in attendance, are there any errors or omission in these minutes? Please submit any of the errors or omissions noted through the Q&A, which is near the bottom middle of the Zoom application. Seeing none at this time, the minutes are now approved. The next item of business is the college's financial statements. The audited financial statements are available online as a part of the college's 2020-2021 annual report. Are there any comments or questions about the financial statements? And again, please use the Q&A options if you have any at this time. Thank you. The report will be placed on file. The audited financial statements have already been reviewed and approved by the board, so no vote is required at this time. I'll move on to item 4, which is the chair's report. Before I begin, I'd like to acknowledge those communities that have been devastated by the flooding and landslides caused by the extreme weather event we experienced this week. We recognize the unfortunate toll this has taken on all British Columbians and thousands of people that have been forced from their homes or stranded due to road closures. On behalf of the college, I'd like to express our deepest gratitude to the pharmacy professionals, emergency service professionals, and volunteers who are working to ensure the health and safety of the individuals and communities that have been affected by this catastrophic event. We want all British Columbians to know that we are continuing to work with the Ministry of Health to support continuity of care for patients during the emergency, and we encourage all BC pharmacy professionals to reach out to us with any questions you may have or support you may need during this challenging time. I'd also like to thank my fellow board members, as well as all of the college staff, for their hard work that enables us to continue to fill our mandate in protecting the public through the regulation of pharmacy practice. I'm proud of everything the college has accomplished in this past fiscal year, which ran from March 2020 through to February of 2021. From responding to the sudden onset of the COVID-19 pandemic to continuing to help combat the opioid overdose crisis and working towards dismantling Indigenous-specific racism in BC's healthcare system, the college has been hard at work striving for better health and pharmacy care in British Columbia. I recognize that this time has been an immensely challenging time for all healthcare workers, including pharmacists and pharmacy technicians. While our role as a regulator is to ensure that all pharmacy professionals are practicing safely, I'd like to thank all the registrants joining us here today for their tireless work in continuing to ensure British Columbians can safely access the pharmacy care they need. As the situation regarding COVID-19 continues to evolve here in BC, Canada, and other jurisdictions in the world, the college will continue to work closely with the Ministry of Health and other partners to support the response to the pandemic as part of BC's health system. The COVID-19 pandemic has brought many challenges to respond to, challenges which will continue to evolve in the coming years. Since the onset of the COVID-19 public health emergency, the pharmacists, pharmacy technicians, and pharmacies we regulate have been vital in ensuring British Columbians continue to receive the medications and knowledge they need to manage, prevent, and treat a multitude of diseases and symptoms. In order to support the response to the pandemic and its impact on the ongoing opioid overdose crisis, the college worked closely with the Provincial Health Officer, Ministry of Health, Ministry of Mental Health and Addictions, and other partners to share vital information and enact practice change for pharmacy professionals intended to reduce unnecessary practice strain and provide broader flexibility to continue to ensure adequate continuity of care. Most recently, those authorized to provide injections through the college's drug administration certification and standards, limits, and conditions for drug administration by injection and intranasal route were able to contribute to our province's COVID-19 immunization campaign and help protect British Columbians from COVID-19. I'm grateful for the availability of COVID-19 vaccines for healthcare workers and all British Columbians in this past year. The vaccine is instrumental in allowing those in our healthcare system to protect our patients from harm and preserve our ability to safely deliver health services. Thank you to everyone who has contributed to British Columbia's COVID-19 immunization efforts, from safely providing immunizations to sharing evidence-based information about the new vaccines with your patients. The college recognizes next that cultural safety and humility for Indigenous peoples in BC is vital for the provision of fair and equal health services, as well as the creation of a healthcare environment free of racism and discrimination, where individuals feel safe and respected. Cultural safety is an outcome based on respectful engagement that recognizes and strives to address some of the power imbalances inherent in our healthcare system. Cultural humility is a process of self-reflection to understand personal and systemic condition biases and to develop and maintain respectful processes and relationships based on mutual trust. Cultural humility involves humbly acknowledging oneself as a lifelong learner when it comes to understanding another's experience. In June of 2020, BC's Minister of Health, Adrian Dix, announced an investigation into disturbing allegations of racism in BC's health system. We are also appalled to learn of the discovery of the remains of 215 children on the site of the former Kamloops Indian residential schools. We stand with the Tk'emlúps, Tswépnu, and Ktunaxa First Nations and all Indigenous people in BC as they continue to process this news. The college, along with the BC health regulators, were in full support of the investigation led by Dr. Mary Ellen Turpel-Lafond at Kikwe and the culminating report released in December of 2020. In plain sight, addressing Indigenous-specific racism and discrimination in BC healthcare system. The report found that the majority of Indigenous people in BC have encountered racism and discrimination within our healthcare system, whether as a patient or a healthcare worker. Based on consultation with almost 9,000 Indigenous people and health workers, the report's findings illustrated how our current healthcare system continues to limit access to medical treatment and negatively affect the health and wellness of Indigenous people. In response to the report, the college has been working with Indigenous experts and other health regulators in BC to take immediate action towards dismantling Indigenous-specific racism within BC's health system and to lead a culture of anti-racism among the professionals we regulate. We encourage all health professionals to review the report and reflect on its findings and to continue to practice vigilant cultural humility and safety. To learn about and understand the impacts of residential schools on First Nations communities in Canada, to acknowledge and reflect on the social issues faced by Indigenous peoples, and to understand the historical context from which these issues originate. I'd also like to remind our registrants that any racist behavior among regulated health professionals is unprofessional, harmful to patients, and unacceptable. It contravenes the professional conduct standards to which health professionals are held and constitutes a danger to the public. Further to this, as health professionals, we have a collective duty to report this behavior to the appropriate authorities and/or regulatory colleges. In addition to the findings in the In Plain Sight report, 2020 also highlighted a number of social issues that require deeper consideration of our role as a health regulator in BC. We mourned with Black communities and allies across the US, Canada, and abroad for the deaths of George Floyd, Ahmaud Arbery, Breonna Taylor, Tony McDade, and countless others at the hands of police brutality and a culture of systemic racism and violence. We were disturbed to learn about the surge in anti-Asian hate crimes in Vancouver during the pandemic as well. These events prompted us to recognize and acknowledge the internal biases we may not realize we hold, and to ask ourselves how we may be contributing to the systemic racism and discrimination present throughout North America and here in British Columbia. As a regulator, the college governs over 9,000 registered pharmacists and pharmacy technicians in British Columbia, and it's our duty to ensure that the health professionals we regulate provide safe and ethical care to all British Columbians. As a part of this duty, the college acknowledges that we, as an organization and regulator, need to step up and lead the charge for systemic change with the goal of eliminating the everyday impacts of discrimination and racism within BC's health system. As health professionals, the most important thing we can do is show our country's Black, Indigenous, and other people of color our unending support and remind patients in these communities that we are in this together. While we are encouraged by the progress made leaders and organizations over the past year, we must continue to combat the racism faced by BIPOC and other marginalized communities in BC. I would let our registrar, Bob Nakagawa, go into more detail about the ways in which the college as an organization has worked to address racism within our health system. The opioid crisis is another challenge facing our college. The opioid overdose crisis continues to be a top priority for us and other public health organizations across the province. As you know, we are facing dual public health emergencies with both the opioid overdose crisis and the COVID-19 pandemic response. COVID-19 continues to have a significant impact on the opioid overdose crisis. Following the onset of the pandemic, the BC Coroner's Service has detected a sustained increase of illicit drug toxicity deaths. In total, 1,716 people died of illicit drug overdoses in 2020, a 74% increase in deaths over 2019. This increase is continuing into 2021 with 1,534 suspected illicit drug toxicity deaths between January and September of 2021. The highest ever recorded in the first 9 months of a calendar year, and a 24% increase over the number of deaths recorded between January and September of 2020. Much like in recent years, this past year, the college continued to work hard to help combat this issue by implementing a number of policy changes and temporary exemptions across BC to support continuity of care for people with substance use disorders during the COVID-19 pandemic. The college recognizes there is still much to be done in this pandemic and continues to reflect on how best to serve the public and those affected by the drug poisoning crisis. I will again let Registrar Nakagawa speak more in depth about the various measures taken by the college over the past year in responding to this opioid overdose crisis. Next, I would like to introduce the college's registrar, Bob Nakagawa, who will speak in greater detail about some of the key projects and initiatives undertaken by the college over the past year. I would also like to acknowledge this is the last AGM that Registrar Nakagawa will be attending in his current position. I'd like to thank Bob for his many years of service to the public of BC in regulating pharmacy practice. Bob has steered this organization through much growth, including developing the practice review program, pharmacy manager training, and the introduction of time delay safes to protect the public and pharmacies alike. Bob has been a calm and steady leader throughout the COVID-19 crisis and has addressed Indigenous-specific racism with sincerity and integrity, as you will hear about in the next portion of this meeting. We're so grateful for Bob's legacy at the college and in the profession of pharmacy. So thank you so much, Bob.
Great, thank you very much, Sherry Shoy. Before I begin, I'd like to acknowledge that I am joining today from the unceded and ancestral territories of the Coast Salish peoples, and in particular, the Coquitlam First Nation. Many of you would not know that Coquitlam refers to the unique sockeye salmon that ran abundant in the Coquitlam River just down from where I live and in Coquitlam Lake, sustaining the communities for thousands of years. It's been truly an honor to serve as the college's registrar for the past fiscal year, which ran from March 2020 through to February of 2021. College staff continued to work hard to ensure that we're fulfilling our important mandate in protecting the public, both through our ongoing operations as well as through progress on strategic initiatives. I'd like also to recognize Claire Ishoy for her efforts as board chair over the past year. Thank you very much, Claire, for your service. To start, I'd be pleased to report increases in registration numbers across the board this year. And to give you a brief snapshot, in the 2020 to 2021 fiscal year, we had 6,477 full pharmacists, 891 student pharmacists, 1,687 pharmacy technicians, a number of different categories of temporary pharmacists and temporary technicians, 1,404 licensed community pharmacies, and 73 hospital pharmacies. 2020 was an unforgettable year. It's now been well over a year and a half since the first cases of COVID-19 were identified. And all of our lives have been upended as we came together and did our part to help control its spread. I'd like to start by recognizing all of BC's pharmacy professionals for your unwavering commitment to the people of British Columbia, for providing continuity of care, embracing additional safety measures within your pharmacies, and upholding the highest standards of safe and ethical pharmacy practice. As Chair Risher mentioned, throughout 2020, the college has been working closely with our partners in the Ministry of Health, the Office of the Provincial Health Officer, the BC CDC, and other colleges to ensure that pharmacy professionals have the tools they need to respond to the growing demands on our healthcare system and provide British Columbians with high quality pharmacy care. To that end, here are some of the things the college did to support BC's response to the COVID-19 pandemic. We provided regular updates and guidance to patients and pharmacy professionals through our dedicated resource page at bcpharmacist.org/COVID-19. Of particular importance this past year, we shared information on how to access COVID-19 vaccines and how to help with BC's immunization campaign, including essential steps to protect yourself and your patients from the serious risks COVID-19 presents. We're responding to the pandemic also required us to issue a number of policy amendments to ensure continuity of care for opioid agonist treatment patients. We accelerated the implementation of new delivery requirements for opioid agonist treatment to support continuity of care. And these requirements allow pharmacists to use their professional judgment to deliver drugs to a patient if they feel it is safe, appropriate, and in the best interest of the patient to do so. We also amended the PODSA bylaws and the Community Pharmacy Standards of Practice to permit pharmacists to transfer prescriptions for controlled substances and to accept verbal and fax prescriptions for controlled substances. And finally, we also granted a number of exemptions in order to alleviate the added pressure and responsibility placed on BC's pharmacy professionals as a result of COVID-19. We granted CE exemptions for the Professional Development and Assessment Program, or PDAP, for all registrant renewals between March 2020 and February of 2021. And we enabled eligible individuals to apply for temporary registration to provide pharmacy services, including COVID-19 vaccinations during the COVID-19 pandemic by amending the Health Professions Act bylaws. The college was also able to continue to conduct important quality assurance checks through the practice review program by pivoting to virtual pharmacy professionals reviews, which began in October 2020. As Chair Ishra mentioned, in December 2020, we were disheartened to read the findings laid out in Dr. Mary Ellen Turpin-Lafon's In Plain Sight report on Indigenous-specific racism in BC's health system. Indigenous respondents described experiencing stereotyping, unacceptable personal interactions, and poor quality of care, as well as knowing that they do not feel safe when accessing healthcare services and interacting with health providers. In March of 2017, I had the honor of joining the rest of the province's health regulators in signing the Declaration of Cultural Safety and Humility in Health Services Delivery for First Nations and Aboriginal peoples in BC. Through this, the college pledged its commitment to making our health system more culturally safe for First Nations and Aboriginal peoples. However, the gravity of the findings in the Plain Sight report forced us to take a step back and re-examine our role as healthcare leaders. Such unethical and racist behavior has no place in our society or our healthcare system, and places extra urgency on us as health regulators to continue to push for a culturally safe environment for BC's Indigenous peoples. This disgraceful behavior towards individuals who are seeking help within our healthcare system undermines trust in all healthcare professionals, and we will not tolerate it amongst our registrants or within our health environments. Our job is to protect patients and the public by ensuring the professionals we regulate provide safe, ethical, and quality care. And yet the continued existence of widespread systemic discrimination and inequitable health outcomes for Indigenous peoples makes it clear that we have not done enough. Moving forward, we recognize that working together with the First Nations Health Authority, other health regulators, Indigenous groups, and others will be essential to act on our plan and create a healthcare environment free of racism and discrimination where individuals feel safe and respected. While not technically part of the 2020-2021 fiscal year, as an essential first step in May of 2021, the college, along with the colleges of nurses and midwives, dental surgeons, and physicians and surgeons, issued a formal apology to the Indigenous people and communities in BC who have experienced racism while engaging with us and with the health professionals we regulate. As part of this apology, we committed to a number of concrete actions to uphold Indigenous rights and eliminate racism within the healthcare system. These actions included becoming anti-racist leaders who will foster a speak-up culture where stereotypes, discrimination, and racism are called out and eliminated. Establishing clear accountabilities for cultural safety and humility within our leadership teams. Drawing on Indigenous knowledge keepers and professionals to help guide our work. Providing education and developing practice standards to ensure Indigenous people receive culturally safe healthcare. Investing in supports and removing barriers to ensure that Indigenous people do not feel isolated or unsafe when filing a complaint. Ensuring that board, staff, and committee members are trained in cultural safety and humility, anti-racism, unconscious bias, and, as appropriate, trauma-informed care. Broadening Indigenous participation on our boards and committees and staff teams, promoting anti-racism and Indigenous cultural safety and humility as core competencies for current and future healthcare providers. building partnerships with Indigenous-led organizations to promote system change and dismantle racism, working with our fellow provincial health regulators to implement the recommendations of the In Plain Sight report, and identifying and supporting changes in legislation and bylaws to deconstruct colonialism, value Indigenous ways of knowing, and eliminate harm for Indigenous people. To that end, we have established a Dismantling Indigenous-specific racism oversight group at the college that's tasked with taking decisive actions to eradicate racism from our health system. We are committed to taking action to dismantle Indigenous-specific racism and will continue this important work over the coming years. We encourage all BC's health professionals to review the In Plain Sight report and to learn more about how to improve cultural safety and humility within your practice. In addition to the work continuing to improve cultural safety and humility for Indigenous peoples, we also recognize that much work still needs to be done to address other forms of racism and discrimination in both our healthcare environment and society as a whole. Chair Rishoy spoke about the numerous events that occurred over the past year and a half that served to remind us of how much work we still need to do towards dismantling systemic racism and discrimination from our society and healthcare. Racism impacts the care people receive in our healthcare system, and we all need to do our part to understand its extent and its effects to help create a healthcare environment free of racism and discrimination, where all individuals feel safe and respected. It's a common and unfortunate misconception that BC and Canada are somehow exempt from the racism, discrimination, and stigma faced by our neighbors to the south. This misconception, I believe, is at the core of what we need to change as stewards of public health and safety. The college has pledged its commitment to developing a plan to raise the awareness of and actively combat the racism faced by Black people in British Columbia. To help enact this change, we established a Black Lives Matter working group focused on identifying the ways that the college, as both an organization and regulator, can take action and reinforce the fact that Black Lives Matter and that racism in any form has no place in our health system. I also recognize the discrimination faced by our Indigenous and Asian communities and people of color, and want to reassure members of those communities that we also need to address the injustices and inequalities that you face. Over the coming year, the Black Lives Matter Working Group will continue to develop anti-racism framework and develop an anti-racism framework to guide our organization as we work to dismantle systemic racism and eliminate discrimination based on race, ethnicity, culture, gender, and sexual orientation from both our health system and our own policies as an employer. Additionally, all college staff have already begun to participate in anti-oppression training sessions and will continue with further training over the coming fiscal year. These sessions are intended to empower and enable staff to view and approach the world and their work at the college through an anti-oppressive lens. This training is an important component of the college's organizational strategy towards holding ourselves accountable as an anti-racist organization and ensuring that unconscious bias does not impact the work we do as a regulator. As Chair Rishoy mentioned, we are facing dual health emergencies, with both the COVID-19 pandemic compounding and escalating the existing opioid overdose crisis, which was declared a public health emergency in April of 2016. Acknowledging the marked increase in overdose deaths following the onset of the COVID-19 pandemic, the college worked closely with the Ministry of Health, Ministry of Mental Health and Addictions, and the BC Centre on Substance Use to respond. The college quickly implemented a number of policy changes and temporary exemptions across British Columbia to support continuity of care for people with substance use disorders during the COVID-19 pandemic. In March of 2020, the College Board approved new delivery requirements for opioid agonist treatment, allowing pharmacists to use their professional judgment to deliver the drugs to a patient if they felt it is safe, appropriate, and in the best interest of the patient to do so. As a result, prescribers no longer need to authorize delivery for OAT drugs. Previously, Professional Practice Policy 71 allowed pharmacists working in community pharmacies to deliver methadone for maintenance to a patient's home only if the prescribing physician authorized delivery due to a patient's immobility. These changes aim to improve access to OAT for patients who may benefit from delivery while ensuring the safety of both the patient and the pharmacist involved. Given the onset of the COVID-19 pandemic, the College Board decided to accelerate the implementation of these requirements in order to support continuity of care for BC OAT patients. Further to these changes to the delivery requirements, in April 2020, the College also implemented temporary amendments to PPP 71 that allow pharmacists to authorize regulated health professionals to deliver OAT. These temporary amendments also allowed pharmacists to authorize pharmacy employees, including pharmacy technicians and pharmacy assistants, to deliver OAT on a pharmacist's behalf in exceptional circumstances where it is not possible for a pharmacist or other regulated health professional to deliver the OAT drug. These temporary authorizations align with Health Canada's temporary exemption under the Controlled Drugs and Substances Act to maintain Canada's access to controlled substances as needed for medical treatments during the COVID-19 pandemic, which includes permitting pharmacy employees to deliver prescriptions of controlled substances to patients' homes or other locations where they may be. For example, if people are self-isolating. In November of 2020, the College Board approved amendments to Professional Practice Policy 66, opioid agonist treatment, to extend the deadline for transitioning to the opioid agonist treatment compliance and management program for pharmacy, also known as OATCAMP, from March 31st, 2021 to September 30th, 2021. PPP 66 initially required that registrants complete the applicable components of OATCAMP by March 30th of 2021. However, in March 2020, the in-person OATCAMP training was suspended due to the sudden onset of the COVID-19 public health emergency. The BCPHA developed an online version of OATCAMP, which was accredited by CEEP, and the first online OAT training workshops began on November 20th of 2020. The 6-month training deadline extension was made to recognize the impact of COVID-19 and the temporary suspension of the OATCAMP. As of October 1st, 2021, all pharmacy managers, staff pharmacists, release pharmacists, and pharmacy technicians employed in a community pharmacy that provides pharmacy services related to opioid agonist treatment must have completed any applicable components of OATCAMP in order to fulfill the college's OAT training requirements. Pharmacy technicians only need to have completed the online component of OATCAMP. Registrants who have not completed the required training should do so as soon as possible. During the ongoing opioid overdose crisis, it is in the public interest to maintain patient OAT treatment wherever possible. Madam Chair, I'd like to close by noting, as you did, that this is my last AGM that I will be participating in as Registrar of the College. And it has been truly an honor and a privilege for me to have served the public in this capacity for the past 9 years. I'd like to thank all of the hardworking and diligent board members whom I've had the pleasure of working with for their dedication and support over the years. In particular, all of the board chairs and vice chairs that I've had the pleasure of working with. You have been wonderful to work with during my time as registrar. I would also like to acknowledge and thank the amazing staff at the college. You have been a pleasure to work with over these last almost a decade. I know that the board is close to selecting a new registrar to take over for me, and I'm confident that they will thrive in the position and continue to champion patient safety in BC. Thank you very much. So with that, I'd like to ask if there's any questions on what we've shared today. If you have any questions, please submit them through the Q&A, which is located near the bottom middle of the Zoom application. We may not be able to respond to all the questions today, but I encourage you to reach out to communications@bcpharmacist.org if we're not able to address your specific question. So I'll open the floor and watch for your questions to come up on our screens. Okay, I'll give you another minute. Okay, well, it doesn't appear that there are any questions that you're bringing up at this point in time, but please, if you do have any questions, please feel free to submit them to our communications department, as I mentioned earlier. So at this time, I'd like to turn the meeting back to Chair Ishoy. Over to you, Claire.
Thanks, Bob. Thank you for attending and participating in the college's 130th annual general meeting today. Having completed the agenda, the annual general meeting of the College of Pharmacists of BC now stands adjourned. A recording of today's meeting will be available on the college's YouTube. Thanks, everyone. Please stay safe.
Can I say something, Lady Chair?
Saltson, of course you can.
Nakagawa Sama. Arigato. 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 Sir.
Thank you very much.
Thank you very much. It's been a great privilege for me to have met you this year and to have worked alongside of you. I want you to know that when the young lady said that this was your last time, my heart sank a little bit. You're a wonderful human being. And I'm happy for you. And as I listen today, I want to say to all of you that your work is absolutely amazing and vast. I want to thank all of you. Once again, Nakagawa-sama, arigato.
Thank you very much. So for those who don't speak Japanese, it says thank you, and the sama suffix is an honorific that you use for out of respect. So that respect is heartfelt, and I appreciate it so much, Saltson. And it means so much to come from an elder, a spokesperson for First Nations people, and somebody who I hold in extremely high esteem. And it has been truly my pleasure and privilege to have learned so much from you. And I will continue to do so as I continue on my journey of learning. So thank you for the kind words.
Thank you, Madam Chair.
Of course.